Well, thank you for those who are joining us today. Welcome to our July Wellness Wednesday. Can you believe it? July is over in just a few days, and then it'll be August. So today we will be discussing vision and hearing and how it relates to falls. I'm Samantha Borba. I'm the Health and Fitness Program Manager here for Healthy Aging Association. And we have our amazing guest speaker with us today, Dr. Robert McGrew. And he'll get to jump in a little bit, and you get to hear from two people talking this morning. So here we go. As you just heard, this is being recorded. So it will be posted on our YouTube channel, our website, and on our Facebook page if you have someone who might want to catch it later. And if you feel uncomfortable being recorded, please feel free to turn off your camera. All right. So who is Healthy Aging Association? I recognize most of your names, so you all should know who we are. But we are a not-for-profit organization here in Stanislaus County. And our mission is to help older Americans live longer, healthier, more independent lives by promoting increased physical activity, sound health, and nutrition practices. So I just want to share some statistics with you all. So according to the CDC, so the Centers for Disease Control and Prevention, falls are the leading cause of accidental deaths in adults over the age of 65. I'm sure you've all heard this before. So just a few more statistics for you. Each year, 3 million older adults are treated in the emergency department for fall injuries. Over 800,000 patients a year are hospitalized because of a fall injury, most often because of a head injury or a hip fracture. Falls are the most common cause for traumatic brain injuries. And in 2015, the total medical costs for falls totaled more than $50 billion. Medicare and Medi-Cal shouldered some of those costs, about 75% of them. So what can happen after a fall? We've kind of talked about this a little bit already, but falls can cause broken bones. So from bracing yourself or the impact from hitting the ground. So you could have a broken wrist, arm, ankle, and possibly even a hip fracture. Falls can cause head injuries. So just like we said, traumatic brain injuries often occur because you bumped your head. These can be very serious, especially if a person is taking specific medications such as blood thinners. An older adult who falls and hits their head should see a doctor right away to make sure that they don't have a brain injury. And please take this seriously. I have actually done presentations in person where someone fell that morning, and I think it was a blessing that I was there because they were not going to see their doctor, and I encouraged them to do so. But it's just to make sure that there's nothing more serious happening within your brain that is covered by so much that we can't even see what's happening. So if you fall and bump your head, please, please see a doctor. Many people who fall, even if they're not injured, actually end up becoming afraid of falling. So this person may then cut down on their activities that they do every day. And that decrease in movement actually ends up leading to an increased risk of falls because now you're becoming weaker because you're not moving as much. So I'm going to pass it off to our awesome guest speaker, Dr. Bob McGrew.
Okay, thank you. As some of you may know, I'm a family doctor here in Modesto. For a long time, I was at Cornerstone Family Medical Group. And now I attend part-time at the Stanislaus Family Practice Residency, which is located down on Paradise Avenue. Attending means being a supervising doctor for the medical school graduates who are learning the craft of being a family doctor. So as a family doctor, I worked in the emergency room frequently. I would go see my patients in the emergency room for 30 years at Doctors of Memorial if they showed up after a fall with injuries. I certainly helped to pin quite a few femurs, which is the hip bone, after people had fallen and broken their hip. I was often in surgery helping the orthopedist with that. And then following people for traumatic brain injury too. So, for me, this is a very real problem and something that I've been there and seen the bad results many times. So if we could have the next slide, please. So these are some things that we all know about, but just to, I think for those of us that are here, we can also tell our friends who are our age, or hey, you may need to go get your vision tested. You really don't seem to be seeing well. Those kind of things. Maybe some new glasses. Maybe there's a cataract developing.
It is because I just.
Okay, so presbyopia. Those of you who know a little Greek, maybe those of you who've gone to the Presbyterian Church know that presby means old, and opia refers to sight. So old sight. The eye's focusing power, if we think about it, how can we look up close? It's interesting. Without a lens, without anything to focus, we would not be able to see our hand in front of our face. We wouldn't be able to focus on it. So 2/3 of the focusing power, comes from the front of the eye, the cornea, and that doesn't change a lot over time. But the lens does, and the lens is about 1/3 of the focusing power. So when the lens gets stiff with aging, we call it presbyopia because you can't focus on near objects as well. And I think for many of us, everybody but Samantha, that is something that we need. We need help from glasses for near vision, like seeing the computer screen. And this is really important, obviously, for fall risk, because if we can look down and see that step in front of us, if we can look down and see that object on the floor, if you're over babysitting the grandkids and they left the toy in the middle of the floor and you're looking up at the grandkid across the room, you can easily just boom on that toy unless you have good near vision. And that's happened to me. That's probably happened to all of us who are grandparents. So what's the treatment? Well, first of all, just to not be, I think with everything relating to fall prevention, the number one thing is to be willing to admit that it could happen to you. As long as we feel like, hey, that's not going to happen to me, we're not going to take the preventative steps we need. So obviously it's getting to an optometrist regularly, an eye doctor regularly. And again, optometrists are, of course, the ones who prescribe reading glasses and glasses generally. Ophthalmologists do the surgery for cataracts and other eye problems. So just update those glasses for books, obviously, for computers. The trifocals or progressive readers, which are what I have, means you can focus on the intermediate distance, which is the computer screen. But if you have bifocals, you really may have trouble with computers, and that may be one of the things that's maybe keeping you away from using the computer as often as you could. Okay, so we want to be able to see, for fall prevention, we want to be able to see our feet. And for some people, that's a problem. So let's go into the next slide, Samantha. Now, another thing related to ages, I'm interested, how many of our, if you just hold up your hand, how many of those watching have had cataracts, cataract surgery? Okay, so 3 of you have had cataract surgery. Okay, thank you. Well, I'm on my way. I'm 69, so I'm probably pretty close to cataract surgery. But I don't know if you actually looked in somebody's eye who has cataracts, but if you shine a light in it, you just see this cloudy white substance. The lens actually looks like milk. And that's an aging problem that's made worse with sunlight, excessive alcohol, diabetes, and certain medications, particularly taking cortisone, can speed that development. So late 60s to 70s to early 80s are the most common time. And I think that the important thing for us to remember is what will maybe be a sign that you have it, or if you've already had your cataract surgery, maybe your friends, you can help your friends realize that they have a cataract issue. So blurred vision and glare, that particularly night driving, when the headlights coming at you, really start glaring or shining. If you ever hear somebody complaining about that, suspect a cataract and maybe say, hey, that happened to me. Why don't you go see your eye doctor and make sure that that you're okay. So that would be the real, I think, take-home message for safety on cataracts, is that the blurred vision begins to affect driving is the biggest problem, probably, particularly night driving because of the glare, but also could affect, again, just seeing down at our feet, to trip over that grandchild's toy truck that they left in the middle of the living room carpet, or tripping over a shoe that you forgot to move out of the way, that's on the path between your bed and your bathroom in the middle of the night when the lights aren't on. One of the biggest times we saw people trip at our office, my patients, was going to the bathroom in the middle of the night, or otherwise not having the light on when you're walking around the house. Okay, so next slide, please. I'm going to ask for questions in a minute, but I wanted to talk about other causes of visual loss are less common. And diabetes would probably be the third most common cause of visual loss. And the blood vessels actually get damaged and start leaking because of high blood sugar, high blood pressure, cholesterol issues, hardening of the arteries in diabetes. So that's really important to follow up with your eye specialists if you have even early diabetes. Retinal detachment is good to know about. You may have friends that have this happen, call you up and say, hey, I just lost half the vision in my right eye. It feels like a curtain is coming down over your vision. That's the way people describe retinal detachment. A somewhat lesser condition is called vitreous detachment, and that looks like you have sparks in your field of vision. You can have actually just sparkly vision in one eye. And if that happens, that can be a precursor to the retinal detachment, where the retina which is like the TV screen of your eye, the retina just peels off the back of the eye, and you lose your field of vision. That is an emergency if that happens. And if you're seeing sparks, that's we would say urgent. Doesn't mean you need to be seen in the emergency room, but try to see the eye doctor soon. Okay. And then a less common thing, but it goes along with diabetes, high blood pressure, high cholesterol, and lack of exercise, is the central and branch retinal artery occlusions. And the risk factors are the same ones for stroke and heart attack. So another good reason to see your family doctor routinely, and do the healthy aging online young at heart classes, which help get us going, and even at home are really valuable. Okay, so I think, what's the next slide? Thank you. Okay, Samantha, let's go back to the last slide, and let's just open up for questions about vision. Do you have any questions about your vision, friends' vision, or any stories about falls related to vision loss?
Hi, this is Lydia. I do have a question.
Sure.
In regards to the retinal detachment,
Yeah.
I was experiencing something like flashing light. And I went to my doctor, and they sent me to the optometrist. I think it was optometrist. I don't remember. But anyways, right. So I was told that what was happening to me was silent migraines, because I do have a history of migraine headaches.
Okay. Yes.
So is that something that you have seen on some of your patients? Is that normal?
I have, and I've had it diagnosed in patients in their 70s. So certainly who never had migraine before. So it's a little bit unusual, but certainly not unheard of, like, to have silent migraines. which with the visual loss being the main symptom, maybe not having headaches. Does happen, but it is important to see an eye doctor and, you know, have the back of your eye checked for that vitreous detachment or retinal detachment or signs of hardening of the arteries, like the artery occlusion. Yeah.
Yes, thank you. And then the last question is, stroke in the eye. What exactly is that? And is there a way that you could describe a little bit, you know, what someone would experience?
Yeah, stroke in the eye is generally presents, like most strokes, with a sudden loss of nerve function. In this case, the sudden loss is actually from an artery which supplies the blood and the nutrients to the retina, which is the TV screen of the eye. A little artery plugs up, and then that part of the retina, sometimes the entire retina, depending on where it is, that will die. It actually will get really swollen from loss of the arterial circulation and can die. So people present with sudden visual loss. Sometimes the entire eye just goes black. Sometimes it's part of the eye. Right.
Thank you so very much. That was very helpful.
So again, healthy aging, you know, everything that we do in terms of from diet education to exercise to social interactions, these things all help prevent strokes and heart attacks, including the attack in your eye. Absolutely. Dave, you had a question?
I believe that's for you, Sherry. You have a question,
Oh, Sherry, I'm sorry.
See, I think, yes, sorry, I need to change my name. My husband's not here. It's just me, Sherry. I have pterygium in my eyes from getting my eyes sunburned when I was snow skiing at 18, right. And that pterygium started. How do I know? I guess there's no cure for it or no way. How do I know when it's affecting my eyesight?
Well, that's a great question, Sherry. Just to get everybody on board, pterygium, if I take my glasses off, when you look at the pupil of the eye, pterygiums are on the inside of the eye, and then there's another similar thing that's on the outside of the eye. But these grow typically, there's a little white flesh growing on the eye, and that's actually kind of tissue that grows to protect your eye from irritation. So typically ultraviolet light and wind. So you're obviously right, snow skiing, cross country skiing, being at the beach, this will promote it. And it can get big enough to actually start crawling onto your cornea, which is the part of the eye that we see through, that middle part of the eye, that little dome in the middle of your eye. And it can get to the point where it blocks your vision. And probably, since you said pterygium, is probably on the inside of the eye, I would guess, Sherry, because it can grow on the outside of the eye. And it would block your inside vision. So you would notice you can't see as well to the inside. And the treatment for that is actually eye surgery. They just numb your eye and peel off that little bit of kind of thick flesh that grows over the eye. Does that make sense? Mm-hmm. Yeah, so most people, even if you can see it, even if it's kind of itchy and bothersome, they'll kind of get itchy. Most people, it's not big enough to block your sight. Therefore, they usually won't operate unless it is.
Yeah, I have dry eyes, so I put what do you call it?
Right. Put the lubricants in, yeah.
Yeah, every day. But yeah, I just wondered when I will know to go to the eye doctor. And I mean, I go once a year, but
and that's adequate, Sherry. If you go once a year for this kind of problem, that's adequate because it grows slowly.
Okay.
And you know how at the eye doctor they typically do a visual field test?
Yeah.
Well, when you lose your inside field of vision, the pterygium may be the reason. Okay. So that's how the eye doctor is going to know.
Okay.
When you do that visual field test, it'll show up on that. Does that make sense?
Yes.
Yeah.
Okay. All right. Thank you.
Good question, Sherry. That's good. Anything we can do to keep our vision sharper as we get older is going to help us avoid falls. So very important.
Yeah.
Any other questions? Okay, well, let's go on to hearing. So next slide, please. Thank you, Samantha. The next slide is on fall prevention for visually impaired. All right. And here we just wanted to mention some things that you can do, or maybe you can help your friend. Again, your friend, your colleague, your family member. Like, I have two brothers. I go over to their house, and you see they have steps. Well, one of the questions for the steps is, do they have the railing? So you see the railing on that picture, which is great. And then also steps, railings are very important for bathtubs, and for our frail people, maybe even something to help them with the toilet, raising the toilet, having a toilet seat with handles, with rails on it would be important. But I think having rails for any steps in bathtubs is very important as we get older. The other thing is making the steps visible. And you can see the steps here have a bright orange kind of marker on the steps that you can see easily. So that's very important. If you have a step that is not well marked, it can be a major issue. We mentioned the raised toilet seat. So, that's all things you've heard before from us at Healthy Aging, but good to remind it. Who knows, tomorrow you may walk in somebody's house and go, oh my goodness. Another thing are rugs. I personally hate throw rugs. My wife loves them. I hate them. And the reason is because I've seen so many people trip over throw rugs or slip on them. Sometimes the throw rugs just go right out from under the feet. And I personally tend to trip on those things. If you don't lift if you're in a habit of shuffling, you can do it. So consider things like that. Also, when you are at your grandkids' house, your children's house, to be careful about stepping on toys and everything that they leave. It's like a minefield when I go over to my daughter's house, who has a 2-year-old and a 5-year-old, right? So to be careful there. Okay, let's go on to the next slide. So for hearing, it's less of a fall prevention risk, but it still is certainly an important safety issue. And if you have a fairly sudden hearing loss, probably earwax needs to be considered right away. As we get older, our earwax gets thicker and stickier. Doesn't come out of the ears as well. So we'll see, older people 70 or 80 who kind of are used to not hearing well, and their ears are just totally plugged up with wax. So that's certainly something to think about if you or your friends, family have that issue, and go to see your family doc right away. Now, something that affects not all of us and affects men more than women is, again, presbycusis. So again, we have the presby, older hearing. So old age hearing loss is interestingly, it's associated with decreased reasoning ability. Now, I would never have thought of that, but it appears to be associated with, again, earlier loss of our brain power. And so one of the recommendations is to consider getting hearing aids earlier if you're suffering from this. And hearing aids, of course, are the best treatment. So to encourage friends who are putting off getting hearing aids, if you notice that they're not hearing well, or if your husband isn't, then to encourage them could really help them not just hear alarms better, hear their phone better, hear you better, but also maybe help them with their brain activity. Then the other thing in terms of causes, noise exposure, certainly, and really encourage people to wear earplugs or hearing protection over their ears if they have any kind of powered equipment. And then strokes, viruses, and tumors are less common. But I've got to say that I did suddenly lose most of my hearing in my right ear a year and a half ago. And it turned out to be something that's very uncommon that I've only heard of a couple of times in my 40 years of practice in my own patients. And that was I had sudden sensorineural hearing loss. So one day I could hear pretty well in my right ear. The next morning, I had this loud ringing in the ear. I felt a lot of pressure and I couldn't hear at all. Fortunately, I got some hearing loss, some back, but still can't hear well in that ear. And that can be devastating. So the point I would make there is, it's not a common problem, but if we hear somebody who suddenly loses their hearing and thinks it's, earwax, thinks it's an infection in their ear, maybe something like that, it's certainly good to encourage them to get seen. If they don't have earwax, if they don't have an ear infection, their doctor's going to send them on to a specialist. And if you get treatment early for sudden hearing loss, there's a chance of helping to restore the vision. But if you wait too long, then we lose our opportunity to help. Okay, so what to do? We talked about seeing the primary doctor. We talked about not putting off getting a hearing test. If anyone is suggesting you get a hearing test, or you're suggesting to your friend, encourage them to do it because it may be time for a hearing aid. And then if you know you don't hear well without your hearing aid, or if you like me, losing some hearing, but not quite to hearing aid range, just to make sure all of your devices are loud enough to hear. And I think Samantha was telling me that, or we were talking about that earlier. Yeah. But particularly, your doorbell, your phone, burglar alarm, probably your smoke detector and burglar alarm are going to be so loud that they're going to wake you up from sleep, but you want to make sure other things do too. Okay, any questions about hearing? Or comments, any stories about hearing? I know the main story, since we have mostly women on our video chat today, probably all your stories involve husbands or other men you knew, because they tend to be the ones who are most resistant to getting hearing aids. But I'd encourage you to, to just give them examples of how the hearing is hurting them, and positive encouragement. Tell them about other men who are wearing hearing aids, and they may consider it themselves.
Sherry, you have a question?
Yes, I do. Sorry.
No,
that's why we're here.
Okay, ringing in the ears. I started having ringing in the ears about a month ago, but I have rheumatoid arthritis, and I started hydroxychloroquine about 5 months ago.
Okay.
I haven't seen my doctor yet about the ringing in the ears. Mostly I hear it at night when I go to bed, but I'm starting to hear it during the days when it's quiet in the house too. So is it an aging thing? Is it an earwax? Do I need to go to an ear doctor? Or I read the side effects of the hydroxychloroquine, and it says that ringing in the ears is a side effect. So do I need to see my rheumatologist? Do I need to see an ear doctor? I don't know.
Well, you're absolutely right. And I have a prescription website that I go to for drug information that has really detailed information. So let me just look that up very quickly.
It's hydroxychloroquine for rheumatoid arthritis. I started on it about 5 months ago. My doctor said I needed something to slow down the progression. And
so I'm very familiar with the medication. My wife was on it for her rheumatoid arthritis years ago. And it is listed as causing sensorineural hearing loss. So this is hearing loss with damage to the cells in the ear that hear, or the nerves. not clear how often that happens or to what extent you might get better if you go off the medication. But I would strongly urge you to actually call the nurse of your rheumatologist, give a message saying how long, how much, do you feel like you have hearing loss, or do you feel like you have ringing is the main issue?
It's just ringing. It's just the ringing started at night, but now I'm hearing it in the day too. So it hasn't really bothered my sleeping yet or anything, but I'm just concerned it's going to get worse and it will be permanent. So I guess I need to go see my rheumatologist probably, or
yeah, I think so. And even to call them, as I said, and notice that you have ringing, it can be a side effect. That's always a good thing. You may get a message to, well, go off the medication and we'll see you as soon as possible. The issue is that it's often hard to see your specialist right away.
Right.
So why not give them the information and ask for a recommendation right now, and then maybe 3 months before they see you. But yeah, so that's what I would recommend. Call in and say, okay, good.
Yeah, because it'll take a while to go to my primary care doctor, get a referral to an ear doctor, so
right.
I don't know where to start, I guess.
Right, I would start with the rheumatologist because they prescribe the medication.
Yeah, well, I'm not sure that's what's causing it though.
And then I would go, well, I would call them and give them that message, say, would you make a recommendation about staying on the medication? And meanwhile, go, make an appointment with your primary doctor to make sure you don't have earwax or an eardrum issue or something like that. Does that make sense?
Yeah.
So do two things at once.
Okay.
Right. But happy to talk.
And Lydia?
Lydia. Okay.
Yes, it's really just a comment. I work for the California Telephone Access Program, where we provide a free specialized equipment for people that are hearing impaired, vision, mobility, speech, or memory. And oftentimes what we talk about is the selective hearing, which I know is totally different, but I just wanted to bring that up since you mentioned we're all females here. And sometimes it could, sometimes it could be selective hearing, but yeah, for the most part, again, I just wanted to, if anyone has trouble using a regular phone, look us up and we could provide that at no cost.
Okay, thank you. That's a great service, and I'm glad you told us about that, Lydia.
I have a question.
Yes.
Hi, I'm Diane. Speaking of husbands, my husband he distorts certain words that I say, like if I say dog, maybe he thinks it's hog, or that's just an example, but he says it's the tone that I talk at, that I talk too high. Is that more of an earwax problem, or because he really distorts a lot of the sentences? And so I'm thinking he's got the start of a hearing problem, but he says he saw an audiologist a couple years ago and he was fine, but I'm not quite sure. He's 74.
Right. Well, that is a sign of certainly a lot of us guys who have some mild to moderate hearing loss function pretty well in many situations, but could not understand certain words, and you're more likely to have problems at higher frequencies. So typically, with age-related hearing loss, you lose the higher frequencies first, right? And so women will talk, some women particularly will talk at that higher frequency, and certain words have higher pitches, don't they? So yes, that is a common symptom of having some early to moderate age-related hearing loss, so the so-called presbycusis.
Thank you.
And just because you were okay, again, often what happens is we hear what we want to hear too. And this applies to women also, not just men. But we hear what we want to hear. So you're okay means she may have said, well, you're normal for your age. So you hear the difference, you're normal for your age. Well, the audiologist is thinking, most men at 70 have some mild hearing loss. It's quite common, but they're functioning okay. So, it gets to be I think the major thing is not to nag the husband about that, but to maybe just say, can we talk about it? And here's how it's affecting me.
It gets for some interesting conversations.
Yes. Yes, and it just depends how defensive men are. I again, as a physician, I worked with men who weren't interested in changing often. Yeah, and you know, I just tried to bring up examples that spoke to them and what they cared about. But you know, just I think better rather than making a lot of little jabs and you know, whether we're talking in marriage. I just celebrated my 45th wedding anniversary, and so in marriage, you know, it really helps to to you know, just have times when you can listen to each other when you're rested and you're not upset and those kind of things. And that's when your husband's most likely to listen, I think. And then avoiding pointing it out when he's irritable, he's tired, and all those kind of things, right?
Thank you.
Okay, but best wishes. I know it's irritating when your husband doesn't hear you well. Any other questions? Okay, well, I think we're going to go back to Samantha then.
All right, so what do we specifically offer at Healthy Aging Association to help you reduce falls? So I'm going to touch briefly on each of these programs that we offer here within our small but mighty organization. So Young at Heart Strength Training, Dr. Bob has touched on this a little bit today, but this is our primary program that we have offered. This is what made us a not-for-profit organization. And due to the pandemic, we moved things virtually. So we've been offering our classes virtually for over a year now. So you can do it from your comfort of your own home. And I can say that you all know how to hop on Zoom just fine. So all you need is some adequate space and you can do this at home. We are currently working on reopening some of our in-person classes. And if you were enrolled in a class before, you will get a call when your class opens. However, if you have never been to one of our classes, still give us a call because we can try to find the class that would be closest to you. And when that class opens, we will give you a call. Oh, and those classes work on strength, balance, and flexibility. We also offer Tai Chi for arthritis and fall prevention. This works on improving balance, confidence, and muscular strength. We have a few classes that are opened or will be opening for this program in particular. So you would just call our office and we could let you know which community sites are open. We will be starting next week here at the Stanislaus Veterans Center on Monday, Wednesday, Tai Chi for arthritis and fall prevention class in a nice big open space where everyone will have room to spread out plenty. We offer, if you're not ready to join a group fitness class quite yet, we do offer our Young at Heart Steps 12-week walking challenge. So you can walk anywhere at any time, no groups needed, but our next walking challenge is actually going to be kicking off on Monday, August 9th, and it will conclude on Halloween. So it's a good time. All you do is register. You'll receive weekly motivational emails. We do adherence calls. So every 4 weeks, we touch base with you with a phone call. And then you report your miles to be entered into a raffle and you get invited to a little award ceremony where we pass out rewards or incentives that you have earned for your miles walked. We also offer a matter of balance. We hosted one virtual class, but primarily this is an in-person class in small groups, 8 to 12 participants. And it's the in-person is only 8 sessions long and it meets for 2 hours for the 8 weeks. Participants learn how to view falls and fear of falling as controllable So maybe you know someone, like we talked about earlier, who had a fall and then reduced their physical activity, reduced their outings, and pretty much sat in their chair or sits in their chair most of the time. This is the perfect place for them to start. It's the perfect place for them to get ready to do this class and then hopefully transition into one of our group fitness classes. And then we offer our newest program called Dignity at Home. And this program offers things like Dr. Bob talked about earlier, such as grab bars and railings, shower seat chairs, toilet seat risers, etc., to those who are at risk for falling here in Stanislaus County. And then they have to meet income and either 60 years of age or be a person with a disability. So here are the guidelines. And then for us to go into your home, we do ask that you be fully vaccinated from COVID-19 for the safety of our staff and for the safety of the clients. If you are interested in seeing if you qualify for this, you would just call the Stanislaus County Senior Information Line at 558-8698. After that, it gets sent over to our organization and we will help you further with the in-home environmental assessment and then with the potential of getting some awesome equipment for your home. And so in summary, 5 reasons, here we go, 5 reasons to get your vision and hearing checked. And Dr. Bob, that's annually, right?
Yes, yes,
so,
it is.
So to be able to hear safety alarms, to maintain your good balance, to prevent further injury, to maintain your independence, and overall to prevent falls. So what else can we do to prevent falls besides get your vision and hearing checked annually? You can check your home for fall hazards. If you have an assistive device, please use it, especially if you're leaving your home. When people come and they're using a little cane and I'm like, don't you have a walker? Oh, I just use that at home. Well, you should use that walker outside instead of your little cane as well. So use what gives you the most confidence to move with ease. Watch out for your pets, especially those little ones that just dart through your feet or sit right behind you when you're in the kitchen and you didn't know they were there. So watch out for them. Be careful outdoors. So watch your surroundings. Look for those cracks in the sidewalks. Medication management. Exercise regularly, either walking, gardening, or in one of our programs. And invest in yourself. This is about you and your life and how you want to live it. So I encourage you to join a fall prevention program, and you can call us. Our office is open Monday through Friday, and we'll be happy to help you find a program that works for you. All right, so our next Wellness Wednesday will be at 2:00 p.m. on August 25th, and we'll be diving into home safety in particular and how it relates to fall prevention. Thank you so much. Any final questions that anyone might have? All right, well, thank you so much for joining us, and we look forward to seeing you next month. Thank you, everybody. Take care.
Thank you.
Thank
Bye.
you.
Well, thank you, Samantha. Best wishes.
Thank you, Dr. Bob. I'll
All
talk to you
have to
soon.
do.
Yes, I'll see you next
Okay.
week at board. Bye.
All right. See you then. Bye-bye.